This is the gentlelady from Iowa, Dr. Miller-Meeks, for 5 minutes for questions. Please get on yours.
Thank you, Mr. Chair, and I want to thank all the witnesses for testifying before the committee today. And the lights on. This is a jury-rigged system? No. From my time in the Army. I'm a physician, a former director of the Department of Public Health, and I know how both how serious, how predictable another pandemic is, not when, but we know it will occur. And I also was, I think, the only member of Congress when we were passing the ARRP, or the second COVID bill in March of 2021, that spoke numerous times, both on the floor of Congress and in committee, about the necessity of funding the non-competitive grants that go directly to local public health care agencies, not to the CDC, not to some other, three-letter government agency, but non-competitive grants directly to local public health care. And I'm glad to see that my bill, H.R. 3837, the Improving Public Health Preparedness Act, is included in the hearing, and I thank my colleagues, Congressman Buddy Carter and Congressman Balderson, for co-sponsoring the bill. H.R. 3837 requires the HHS Secretary to delegate the maintenance and administration of the Strategic National Stockpile to the Administration for Strategic Preparedness and Response, which further enhances ASPR's authority over the SNS. SNS had a few homes since it was established in 1999, CDC, DHS, back to CDC, and then to ASPR in 2013, and operates most effectively under ASPR's jurisdiction, which is why their authority was expanded in 2018 under the last Pandemic and All Hazards Preparedness Act, or PAPA. This legislation is a clean codification of SNS's current authority, which would bring welcomed stability and clarity. Furthermore, it seeks to demonstrate ASPR's leadership as the lead agency for our nation's preparedness and response to public health security threats, as we just heard through the last question and response. Dr. Parker, in your written testimony, you say the SNS, along with other offices, belong together under ASPR and that they are each better served in this structure. Can you please explain why you believe this?
Sure. I mean, I think it's and I'm really happy to see this legislation. It makes a lot of sense to have BARDA, the Strategic National Stockpile, and the industrial-based supply management components of ASPR consolidated under the ASPR. And I think, then how is the ASPR also going to manage and integrate, make sure that there's an integrated, seamless flow between the development of medical countermeasures, the acquisition, the procurement, the stockpiling, and also ensuring that the industrial supply chains are more resilient. So it's just logical that they're together. And it's also logical, we talked about NDMS and the support of the healthcare system also, they're just logical that they're together.
Yeah, I couldn't agree more. I had a bill in last term on medical countermeasures that went through Homeland Security, as I was a member of Homeland Security. So having this efforts that are helping to coordinated, I think would be beneficial. Ms. Arthur, in your testimony, you state that the SNS needs adequate resources to allow ASPR to manage the full life cycle of all medical countermeasures developed under BARDA. Using existing funding and resources, do you believe that SNS is most equipped to manage medical countermeasures while under ASPR's authority, and what changes in SNS's structure would Congress consider to ensure we are stockpiling the most modern and effective MCMs?
Thank you so much for the question. I agree with Dr. Parker. This is an extremely important aspect of the role of ASPR. They actually work closely with their industry partners to manage the life cycle of particularly those medical countermeasures that are going to be stockpiled in the SNS. And so having that end-to-end view of how those products will be used, how they're stockpiled, sharing the requirements, doing replenishment is a core role of ASPR. And anything that can strengthen their ability to share those requirements with their industry partners and do active replenishment with the right funding for the SNS will be a support for pandemic preparedness.
Thank you. I yield back, and thank you, Chair, for this important hearing.
Thank you. The gentlelady